Section 1 of the training course on demographic evaluation of age and sex data. What we're going to be doing today is starting the formal process of the training course. And in this section of part 2, we're going to be covering the introduction to data analysis, some description of the types of error often encountered in the analysis of data, a description of the sources of error which one might encounter. We're then going to briefly consider what we term the assessment analysis cycle, a way of thinking about how one goes about deriving estimates and evaluating the validity and accuracy of those estimates from demographic data. After that, we'll be talking about the different types of assessment which might be used to do that investigation, and the modes of assessment, how one actually goes about doing it. Now, the UN principles and recommendations for population and housing censuses observe that a census involves not only collecting and compiling the data on a population, but also the evaluation, analysis, and dissemination of those data. And so when one's talking about collecting demographic data, it's not simply the act of collecting and creating a machine-readable format of it, but also that process of evaluation and analysis. And ideally, we would want data from censuses and surveys to have been so well collected and compiled that the processes of evaluating and analyzing the data are rendered both trivial and mechanical. Unfortunately, the reality is somewhat different, especially in developing countries, where the kinds of problems which are routinely encountered really do make the process of evaluation and analysis a little bit more complicated. Griff Feeney, a well-known demographer, noted, "In a perfect world, data would always be complete, accurate, current, pertinent, and unambiguous. In the real world, data is generally flawed on some or all of these dimensions." And really the purpose of today's section, part 2, section 1, is to explore the dimensions under which those data might be flawed. Part of this stems from the fact that demographic data collection is not a completely scientific exercise, in that the data are collected by individuals on individuals, and therefore cannot be likened to a scientific experiment as conventionally encountered, where repeating the same exercise again and again will always generate the same results. When we're thinking about the kinds of error encountered with demographic data, there are two kinds. The first is what we call coverage error, and the definition for that is the faithfulness of the correspondence between the records that constitute the data set, in other words, what was actually collected, and the statistical aggregate that that data set represents, or is meant to represent. And coverage error stems and arises from the fact that not all people, or people in a given area, or people with given characteristics, are even interviewed or enumerated. Hard to reach segments of the population or geographically remote areas might result in not everyone who should be being interviewed or sampled being interviewed or sampled. By contrast, content error refers to the completeness and accuracy of the information contained in the data set. And here, content error arises from the fact that answers given in response to a question or a set of questions do not necessarily conform to the actuality of the situation. People might not want to reveal, for example, their country of birth for fear of persecution or being identified as an illegal immigrant, for example. When we think about how those errors might arise in the data, in terms of coverage error, which relates to the inability to fully sample and to make your data set representative of the population being studied. In censuses and surveys, this might arise from poor enumerator training and management, or from seasonal or climatic factors. A flood, for example, might render parts of a country inaccessible. There might be war, insurrection, and violence, which limits the ability to collect information from certain parts of the country. There might be linguistic or other operational difficulties in actually, once having got there, to actually make the survey instrument accessible to people in certain parts of the country or certain regions. And then there are likely to be systematic exclusions, which affect the coverage of a population. For example, nomadic populations or the homeless might be systematically excluded if your design for how you are going to collect your data is based on residential addresses. In the context of vital registration data, coverage error might arise from the lack of reach of government services or registration offices, so that individuals are not able to access those services or those offices in order to register a birth, simply because they might be too far away or too remote. Content error, that is, error relating to the answering of the questions, in censuses and surveys might arise from poor enumerator training and management. It might arise from poor or incorrect translation of the survey instrument. It could arise from badly phrased, incoherent, or complex questions, which confuse the respondent and so do not elicit the answer to the question which was actually being sought. More recently, with the advent of the use of scanning to capture information collected on paper questionnaires, scanning might create content error by miscoding 7s and 1s, for example, and unless the enumerators are trained as to how to best write a 7 or a 1 in such a way that it is not subject to scanning error, you might find that those problems do manifest themselves in the data. We might have content error arising from changing definitions. A certain part of a country might have been regarded as rural at one time point and has been reclassified as urban in another. And this might create some inconsistencies in the data. Finally, we would have what we call reference period error. If respondents are asked to recall events occurring in 12 months before a certain date, depending on how the question is phrased and how it is asked and how the respondent understands that question, they might either include or exclude events which did occur or didn't occur in that very narrowly defined period, as if they had occurred. Finally, the editing and imputation process, the post-collection data management, might induce errors into the data by means of poorly specified editing and or imputation rules. In the context of vital registration, badly designed data collection forms might result in content error, and poorly trained administrative or medical staff who are entrusted with completing those forms might not know how best to complete those forms and therefore produce errors in the data because of their lack of understanding of how best to complete them. Now, when we're talking about the analysis of demographic data, when we are going through that process, we focus almost exclusively on the completeness and accuracy. In other words, the content errors in the data. In many textbooks, in many training environments, data assessment is often thought of and is presented as a precursor to data analysis, something you do before you analyze your data. Sometimes this is a useful distinction, but in most demographic work, the assessment of error and the drawing of substantive conclusions are different sides of the same coin. And so we have to see the process of data assessment and data evaluation and estimation from demographic data as being part of a nonlinear iterative process. And so to reiterate, and one can imagine how this process then works out, is that the process of evaluation and analysis is neither an exact science, nor is it linear. And what we would tend to do is we'd start off by evaluating and assessing our data. We would then draw some estimates from those data. Having done the estimation, we would then look at the estimates which we have derived and assess those and evaluate those for their reasonability. And if we encounter a situation where we think that those estimates which we have derived are not plausible or not valid, we would then return back to our data and reevaluate and reassess it as to say, why did this estimate not produce an estimate which we thought was valid, and the whole process would start again. Before starting with analysis or estimation of one's data, you need to have some initial understandings of what's in your data. In broad terms, we ask ourselves, are the data which we have consistent with what we'd expect to find? You might want to compare your data with projections from a previous census or survey. You might want to compare your results with other data sources, for example, a mix or a demographic and health survey. We might also want to know before we start what areas or aspects of the data are known to be problematic, either in terms of coverage or in terms of completeness of those data. We then would move on to the second part of the evaluation and assessment cycle, which is the drawing of estimates. And here, if we draw those estimates, what we'd look at, we'd say, are those estimates that have been derived consistent with previous estimates? Are the levels and trends implied by those estimates plausible? Less commonly, we might want to ask ourselves, in the context of overall population dynamics, do those estimates result in sensible macro level trends? For example, if your estimates indicate that fertility has fallen rapidly over time, do population projections over that period from other sources bear this trend in fertility out? And so we can start seeing how we need to revisit our data assessment and our estimates and our estimation procedures in a recursive fashion. To begin the process of evaluation and assessment of our data, before you even start, you need to ask yourself several crucial questions. Firstly, what other data might you want to use as comparators? Are they available? Where would you source those data from? You need to understand the data which you're going to be working with. How was the survey questionnaire, the census questionnaire designed? How were different questions coded and what options are given to people in answering certain questions? When you then need to go on to say, what was the design of the data collection exercise? How were those data collected, and what was the process and the logistics of collecting those data? If you're working with survey data, for example, you'd want to understand how that survey was sampled. What was the sampling frame used? How did they deal with non-response in those data? And finally, you'd want to understand the logistics, the planning, the field reports from the data collection exercise. Thirdly, you'd also want to understand something of the history surrounding the context of that data which you're working with that might have had a bearing on your data and the data collection exercise. You'd want to be certain that there haven't been boundary changes, where even at a subnational level, a provincial boundary might have shifted over time, even though the province names have stayed the same. And you'd need to ensure that you're working with consistent boundaries over different periods of time. You'd need to be aware of wars, famines, ecological disasters, which might have affected the collection of your data. And you'd need to understand if there are any political dynamics which might have compromised the collection of your data. When we're thinking about types of assessments, of what classes of tools might exist to assess your data, we draw a distinction between what we call external consistency and internal consistency. External consistency is the evaluation of one's data against data from a source other than your own source of data. For example, you might want to compare the age-sex structure in your data with that from the UN World Population Prospects, which is a national level set of population projections produced every 2 years by the United Nations Population Division. A particular form of evaluating the external consistency of one's data is possible when your data is drawn using a sampling frame determined from another source of data. And under such circumstances, it would follow that the basic population characteristics in the sample which you're working with should be virtually identical to those in the population used to determine the original sample. And this is frequently encountered in the case of a demographic and health survey, for example, which uses a sampling design most usually determined by a recent census or the most recent census conducted in that country. Furthermore, if the data are intended to be representative of some defined population, either nationally or provincially or sub-provincially, you'd want to compare the observed age and sex structure against other data for that same population. While one does those comparisons, some differences are almost inevitable as a result of sampling error, but overall, the populations should look fundamentally the same. For example, a demographic and health survey, which is sampled off a census, should have almost exactly the same age distribution of women as the census from which it is originally drawn. So we can look, for example, at data from the South African Demographic and Health Survey of 1998, which presents a distribution of women by age 15 to 49. And these data from the South African Demographic and Health Survey of 1998 were sampled from the 1996 South African census. And we can compare the proportional age distribution of women 15 to 49 from the two sources of data. The red line represents the 1998 Demographic and Health Survey, the blue line, the data from the 1996 census. And we can see that there are no glaring discrepancies between the two sources, and we can be fairly confident that these two data sources are largely coherent and consistent with each other. We do notice, however, that at age 35 to 39 and thereafter, the DHS has slightly more women proportionally than does the census, and conversely at younger ages. What we cannot know from doing this comparison, however, is whether this is as a consequence of the DHS undersampling women up to age 34 or oversampling women age 35 and older, because the sum of those proportional distributions is in each case equal to 1, and therefore a slight deficit at one point must of necessity result in an excess at another. So you do need to be aware of the risk of drawing firm conclusions from proportional data. You can't say definitively that in this case, the DHS slightly oversampled older women and undersampled younger women, and say it is definitely the case that it was the oversampling here which resulted in the undersampling there, or vice versa. The second form of assessment is what we call internal consistency, which involves evaluation of the data as to the coherence within the data. And here, our starting points are usually determined by prior knowledge or common sense. What would we expect to see in the data? One of the difficulties of trying to assess data using internally consistent methods is that they typically expose coverage and content errors simultaneously. And it can be very hard to distinguish which is a coverage error and which is a content error without further investigation, which would then further require some checks with respect to external consistency. When one wants to investigate the internal consistency of some data, there are some preliminary checks which one does on an external basis first. You ask yourself, is the overall count consistent with other estimates in the same ballpark? Are the urban and rural or subnational populations broadly consistent with what you would have expected? You might want to compare the average household size in your data with that from another data source in order to make sure that you haven't missed out either very large or very small households in your data. And you might want to make sure particularly that the number of single person households is consistent with previous data, because single person households are usually the most easily missed in data collection exercises if there's only one person resident in the household. But one would then, having established that on a preliminary basis, the external consistency might be broadly plausible, you then need to check for the high instance of illogical or improbable outcomes internally in the data. You'd want to make sure that, for example, there are no large numbers of men reporting to have given birth, or infants who claim that their marital status is divorced, 10-year-olds claiming to have a PhD or tertiary education, or young children earning more than a very large sum of money per annum. And those kinds of checks are internal checks to say, is the data which one's working with, is it likely to have collected information which is logical and probable in the context in which you're looking at? But how does one actually go about doing the assessment of demographic data? The most important determinants of all three demographic processes, that is fertility, mortality, and migration, which collectively determine a population size and structure, are the age and sex structure of that population. Fertility happens amongst women. Only women give birth, and then only within a fairly narrow age range, say from age 12 to age 50. Mortality is highly affected by the age and sex structure of your population. Male mortality is routinely higher than female mortality. And by age, we know that infant mortality is often very high, and that mortality rates fall as children become older, and mortality rates then reach a low somewhere around about age 10, and then start increasing thereafterwards, and particularly at older ages. And migration is equally affected by age and sex. Maybe men or women might migrate more or less than each other, and there's a very distinct age pattern associated with migration, with young adults being more likely to move than those in any other ages. And so it follows then that in any demographic data evaluation exercise, attention must first be directed at understanding these aspects of the data, of understanding the age and sex data, so that you know that whatever you are estimating is indeed likely to be reasonable and plausible. And really, that is what the rest of this workshop is going to be looking at going forward. Just a reminder at this stage, and this will be posted at the end of each of these video clips, that if you have any queries or questions on this material, please email me, Thomas Moultrie at un.org, and copied to escap-crvs@un.org. I will do my level best to answer questions, either by return of email or in the first plenary session on the 27th of May, 2022. In the next sessions, we will go through the detailed process of analyzing age and sex data from census, survey, and vital registration data. I hope you have enjoyed this video and look forward to seeing you at the first plenary session on the 27th of May. Thank you very much.